Good. Well, good evening, good afternoon, good evening, everyone, and welcome. My name's Joanna Schellenberg. I'm from here, the London School of Hygiene and Tropical Medicine, and it's my very great pleasure to introduce our speaker tonight and our discussant, and I will attempt to chair the discussion at the end as well. I'm going to do the introductions first and then talk a little bit about timing and also mention what materials we have down at the front. At the end, you might like to come and get some of them. So, Mariam Claeson is Director of the Global Financing Facility for Every Woman, Every Child. Previously, Mariam was Director for Maternal, Newborn and Child Health at the Bill and Melinda Gates Foundation, which she joined in July 2012. Mariam spent 7 years as Regional Programme Coordinator for AIDS in the South Asia region of the World Bank, and 8 years before that as Lead Public Health Specialist in Health, Nutrition and Population in the Human Development Network of the World Bank. And I think it was during that time that I first met Mariam. It was in a beautiful setting in Bellagio in northern Italy, as we were both participants at the workshop that led to the 2003 Lancet Child Survival Series. Before Mariam joined the World Bank, she was responsible for country implementation at the Global Programme for the Control of Diarrheal Disease at the World Health Organization. And Mariam has worked in, as you can probably tell, numerous countries throughout her career, including clinical practice at the rural district level in Tanzania, Bangladesh and Bhutan. So I want to just say thank you very much for coming and welcome to Mariam. And I want to say a few words of introduction too to our discussant, Jo Borghi. So after Mariam's talk, Jo will lead the discussion. She has a few comments and some questions to kick off the discussion. So Dr. Jo Borghi, she will start off our discussion today. Jo is an Associate Professor in Health Economics here at the London School. Her research focus is the evaluation of financing reforms in the health sector and their effect on access to care and financial protection. She led an evaluation of a results-based financing scheme in Tanzania. She's also led the Countdown to 2015 work on global resource tracking and aid flows to reproductive, maternal, newborn and child health from 2003 to 2013. So Jo will give her comments after Mariam talks. So Mariam will talk for roughly 30 minutes, might be a little bit longer. And then we'll turn to Jo next. She's got a few comments, maybe 10 minutes. And then we will have 10 minutes, maybe 15 minutes for discussion before we go down to a reception, to which you're all very welcome in this South Courtyard atrium area. We have over here some materials. We have a whole variety of materials here. Reese will kill me if I don't say, look, there are free USB sticks. They have nothing to do with the topic of the talk, which is about the Global Financing Facility, but they're still really interesting because they're from the project that I lead, which is called Ideas. But there are some materials from the Global Financing Facility here. Not enough for everyone, so please don't.
No, there's more.
Are there some more?
We've taken them down to the reception.
Oh, thank you so much. So they will be done in the reception, and there are more, so there's no need to have a scrum. That's the message I'm getting. And there are various other materials here from Countdown, from March, and from Ideas. Good. So without more ado, welcome to Mariam.
Thank you so much. Thank you.
Let me start by saying how impressed I am to see so many on a topic of financing and on a late Thursday afternoon. That's really lovely, especially since I understand for those of you who are students here, this is not a mandatory session, but optional. But maybe for the same reason as I'm focusing on financing these days, you are interested in it. And I think it's a very timely, right now, topic to talk about, because I think so many are thinking about how are we going to secure financing for mothers, newborns, children, for women, girls, and adolescents. How are we going to make sure that we don't only secure financing for these population groups, but how are we actually going to increase the financing? I think also it's a very opportune time because we who've been working in the Global Financing Facility have been in this startup for some 18 months, so we are starting to get some real data, some real experience about what's actually happening in countries. So I'm not just going to talk about aspirations and what we would like to see happening, but actually some of the experience we have gained to date. So what I thought I would use my 30 minutes, I will promise to waive if I go beyond the time, is really to talk about why do we have it? What is it? Because I still get many questions. What really is it? How does it operate? And really, who is engaged and what is it we're trying to achieve? So let me start by saying the reason why we have a global financing facility for every woman, every child, was a recognition that in the end of the MDGs, there were some lagging indicators. So even though we beat our chest and we're very proud that we made some significant progress during the MDG period, halving child survival, etc., if you look at where there's some of the lagging indicators are, they are really around child mortality, more importantly newborn mortality and maternal mortality. So the countries who didn't achieve those goals, there is quite a significant numbers who didn't make progress. So the question is, how can we ensure that we reach those we didn't reach during the MDG era? How can we reach out and actually achieve an increase in coverage and try to do something not just about survival, but also thriving of newborn mothers, adolescents, etc. So that's a huge challenge, because in some ways we caught those low-hanging fruits, right, earlier, and now it's really about reaching out to those who weren't reached. The second reason is that when we talk about development finance and money available for this area, actually the development aid money has never been bigger, greater than in the last few years, but it's still development assistance is still a very small sliver of that pie, domestic finances, remittances, and foreign direct investments in countries. So we're actually talking about a very small share of the pie that goes into the areas we care about. And if you look at these two bubbles, on the left-hand side you see what it would take to close the gap in financing for reproductive, maternal, newborn, adolescent child health. It's about 33 billion, take plus minus a few billions, but that's an annual financial need of 33 billion. And if you look at, again, development assistance for health to date, it's about 36 billion a year. So if we would succeed, we would take the whole share of development assistance, and you all know this is a very competitive field. So how do we reconcile that we want to accelerate progress, and how do we think about financing? And clearly, the reason why I'm here and why we are here is that we need to think differently about development finance. Because how do we tap into those resources that we currently are not able to tap into? Let me also say a little bit about the Global Financing Facility. So it was set up to be the financing arm of an effort to really bring every woman, every child, everywhere to the fore. And many people talk about the global architecture. It's so complex and confusing, but for me it's actually very easy. If you take a country focus, if you put country leadership at the heart, then look at the global architecture. And what we claim at the bottom, where you can't see in fine print, is really the financing aspects of that. And the upper right-hand side has the accountability and advocacy, where partners like the Partnership for Maternal and Newborn Child Health, civil society plays a role. And in the left upper hand corner, you see the technical agencies that ensure that we actually invest in high-impact interventions. So if you take a country lens, and by country I think it's both government and civil society we're talking about here with countries. So how do we have a new model for financing that puts the country in the driver's seat, and we all ensure that the country driving this effort are investing in the highest impact interventions, that there is some accountability for results, and that we secure the financing. At the top of this, there is the Every Woman, Every Child, because the interesting thing is, with the new UN Secretary General, that the one thing that's still in the UN Secretary General's office is this effort that was launched some years ago to focus on every woman, every child. And to me, that's very encouraging. So, you know, we are hoping to continue to have that attention at the higher political level. But what all of you and I care about is, of course, that translates on the ground into financing. So let me give you one slide, and we have it there. Please pick it up afterwards. What we mean when we talk about smart, scaled, and sustainable financing to bridge that gap. If you look at the left-hand side today, we estimate that there is a 33 billion gap. What we want to do by 2030, as you all know, we want to eliminate all preventable maternal, newborn, child deaths and improve the health and development of adolescents. To close that financing gap, the GFF do a few things. Look at the top. We close the gap by increasing the efficiency of investments. How do we make sure that we are indeed investing in the highest impact interventions and approaches? And we think that we can actually continue to close the gap by looking at that, but that's not sufficient. At the lower end, you see a trend that looks at just at the economic growth and things happening around us. This might actually be an overestimate of where economic growth is going. So please keep aware that we probably need to do some revisit in the data that underpins this presentation, specifically where economic growth is going. But then what the GFF does, the Global Financing Facility does, is to really try to mobilize additional domestic resources in addition to just what you get from growth itself. Secondly, try to look at all those investments that's done bilaterally, right? By DFID, Swedish SIDA, USAID. Can we get donors to be more aligned around a core set of results? So bringing an alignment around financial flows that goes bilaterally. And then what the trust fund of the Global Financing Facility does is linked to IDA, to World Bank financing, at a proportion of 1 to 4. So $1 put in there would yield you an additional 4. So it's that combination of domestic resources, complementary financing, efficiency gains, and also getting money that countries get through World Bank financing to all actually focus on one thing. That's a country investment case for reproductive, maternal, and newborn child health. That is the shift in the way we think that financing will be both scaled and sustained. And I'm sure you have questions around that we will go back to. So there is an enormous interest among countries to be part of this. If you look at this map, all that's dark gray are all the eligible countries. And countries are eligible that have a large needs, where there still, as I said, are lagging indicators in the field of reproductive, maternal, and newborn child health. What's in green are the first 16 countries that have been part of the first round of countries that has received this support by donors and started a country-led process to develop an investment case. But most importantly, it doesn't end there. It's that dialogue with ministries of finance and getting it into the budget and the finance that's important. Because all of you know, who know countries well, there are a lot of costed action plans for newborn, for mothers, family planning. But how do we make sure that these costed plans actually get financed? So that is what we're trying to do through the GFF, is revisiting countries, creating this partnership that takes forward an investment case. And the reason why we are hosted by the World Bank and we don't sit somewhere else is that we need that entry to the ministries of finance. And for all of you who worked in development, you know that's really often the missing piece, is linking up with ministries of finance and seeing change reflected in budgets. So the overview, quick around the GFF, what we do is trying to get smart, scaled and sustainable financing, high impact, bringing things to scale and sustainable by actually having things reflected in budgets and getting that multiplier effect from different sources, and a focus on results. So that's your opening to look at the accountability of these, the country plans is. What are the results that we claim to achieve, and monitor that. But we also, of course, use results because some of this is results-based finance. There's a lot of that in here. And there is also a lot of paying for performance and other innovations, because the fifth arm that I forgot to mention is, of course, the private sector. So what we're trying to do is crowd in not just public money, but private money towards these country investment places. And that's where we do a lot of innovation, social impact bonds. I hope my economist colleagues want to ask me questions about these things. But social impact bonds where you have private sector paying money, for example, in the Cameroon up front towards an increase in kangaroo mother care. And then at the end of that, if the country achieves those results, we come in and pay back based on outcomes. Or we do the reverse. In northeast Nigeria, where we are trying to get quality services in very difficult areas, we do medical credits to see how can you get people to invest in good performance in tough areas and de-risk that capital. So there is a lot of different innovations around that we are also engaged in. So the how of the GFF is the investment case becomes very important, as you can imagine. Getting the complementary financing is key. That's why we, bilaterals, and I'll mention a few, USAID, JICA, my own government, Sweden, they are now coming in supporting it also through bilaterally around one plan. And then really engaging in health finance reform. And I should mention that the effort on health finance reform, of course, goes beyond reproductive, maternal, newborn, and child health. That's the broader, and that's also our contribution to universal health coverage. And then there are global public goods. In every investment case, there are questions around commodities, of course. There are questions around, do we have the right frontline workers able to deliver on this? So there are human resource question, capacity question, cross-border learning, etc. So there are some important pieces here around global public goods. There is a confusion, for those of you who are familiar with the global financing facility, between a broader facility and the trust fund. So the global financing facility is, as I said, a country partnership. There's also a global partnership around the GFF, which includes the countries that are engaging in this. That includes the UN, UNFPA, UNAIDS, WHO. That involves private sector participants and CSOs. But within the broader facility, there is this piece that I also represent, which is the Global Financing Facility Trust Fund. And as I said, the reason why we have a trust fund linked to the World Bank is to be able to leverage, buy down interest, and find different way of leveraging World Bank financing to contribute to these goals. This is the scenario that I think you all know about with the big bubbles here: government money, donors, private sector, caring about maternal, newborn, child health, family planning, adolescence, but all fragmented. So what we're trying to do through the government-led initiative is bringing them together around results. Government, the GFF Trust Fund, Gavi Global Fund, by the way, are members of the GFF, because of course you want to make sure that when Gavi cannot continue to support a country that's transitioning economically, don't qualify for Gavi support, then we could kick in through that sustainable financing plan and ensuring a continuation of financial support for what Gavi is investing in. Global Fund, of course, we partner there too. As I said, they even are. We're even looking at ways that we can co-finance and buy down loans together. And then you have the donors, as I mentioned, JICA, USAID. Many countries who have been investing in the past in sector-wide approaches, in health systems, budgetary support, are concerned about where does the money go. And the attraction they find with this, the country plan, is that strong focus on results and the accountability for results, that sort of regain trust in this government-led effort. And then the private sector, in particular, I would say in Kenya, Uganda, some extent in Cameroon, Senegal is a beautiful example of where the private sector is playing a key role. Just to mention, so for example in Senegal, the government really noticed that commodities for family planning were available in the central stock, but not where women needed it in the field, right? So how do you get that last mile? So there, the government asked the Bill and Melinda Gates Foundation and Merck for Mother, could they, using the knowledge and the know-how that the private sector has for reaching with commodities to the last mile, and they developed a system that works very well. But then the government comes to the GFF and says, here we have something working, can you ensure that this is sustained? So we don't just have a great initiative in a few districts, but how can we go to scale and sustain it? So that's the kind of arrangements that we work together around. When we talk about increasing domestic resources, what do we really mean? Well, we mean increasing revenues, growing the pie, prioritizing health within the government's budget, which is more growing the slice within the pie. That's how I understand it, being not an economist. I look at the size of the pie, the slice of the pie, and then within the pie, are we getting value for money? So efficiency and budget execution. And you may say, well, that works in some places, but can you really do this in a fiscally constrained country? So I just want to say that a country like DRC, which is one of our front runners here, they were able to do that even under very fiscally constrained circumstances, looking really carefully at how can we increase our budget expenditure. If we are only spending about 60% of the budget we have, how can we bring it up to 80%? How can we get a line item into the budget and secure funding for example, family planning in this regard? So I just want to say that this is an opening that we have around domestic resources, and what the financing facility does is helping to look at the best option for domestic resource allocation, helping with fiscal analysis, fiscal space analysis, looking at how they can support the government. Can we do sin taxes and get more revenues out of that? What are the instruments at hand? And then, of course, also looking at the implementation support, because what we're talking about here is also requires capacity to do financing well, as you know. How many of you have worked with ministers of health and know that they often are not included in the Minister of Finance discussion around priorities? So how do we get, the sectors that we care about to those tables, to those discussions? And I should also say that because we are outcome driven, we care about what happens at birth, early years and adolescence, that draws in other sectors. So the GFF also finances, conditional cash transfers and various ways of trying to incentivize girls to stay in school. So educational interventions, water sanitation interventions. So it's also across the sectors, but I would say that we still have a lot of work to do there. The major thrust is really in health. So what is this GFF partnership at the country level, the country platform? It's made up of the government, of civil society, private sector, players, affected populations. That is, what voice do mothers, newborn, adolescents have? I think the youth constituency has been most effective in trying to have a voice here. There are multilateral, bilateral agencies and the technical agencies around the table. The approach is to try to be inclusive and transparent, and I say try because I think this is an area where we need to do much better as we go forward, because there is a diversity of approaches. Some countries already have platforms of this nature, others have to actually create it, and as I said, we don't have a blueprint, but we are trying to just support these processes so that we have roles defined, preparing this investment case, finalize it, engaged in the health financing strategies, bringing together the complementary financing, coordinating technical assistance. So for example, if you take an national adolescent health plan that's been developed in one country, maybe UNFPA helps there. I think that's the case in Liberia. The WHO was the technical go-to. UNFPA was in another country, because one thing that's emerging from these investment cases, if you really look at the biggest priorities and the biggest gaps, much of that is around adolescents. So again, where do we have the expertise that can help and support this? Monitoring and evaluation still is an area where I think we can do much better, but because this global financing facility grew out of the results-based financing, we have a lot of, in almost every country, there is a component looking at results-based financing, paying for performance and other kinds of methods to try to ensure high performance in the peripheries. Here are the partners at the global level, because as I said, we have a GFF investors group where of course we would love to see more flags and more partners, but on the same time, here is some of those that are currently part of the GFF. CSO engagements, as I said, governments are so clearly our, the counterpart here, but the CSO constituencies, of course, see a great opportunity here to also secure not just finance, but to play an important role in terms of accountability. So although I think for many of us, it's not about having a seat, but meaningful engagement. So members of the civil society community are actually right now finalizing a strategy for how they can be meaningfully engaged that we will be looking at in the investors group in 2017 to make sure that there is an engagement not just at the implementation phase, but throughout the process. Now, what do we mean by results, and what's the pathway between what we finance to results? And I want to take one example just so that to try to highlight there. We look at, for example, improved sexual, reproductive, and health rights outcomes. Then there are different ways you can influence it, as you all know. You can do dedicated interventions to influence these outcomes. You can do it as part of integrated delivery approaches, right? You have an essential package and you might have a component there that provides certain deliverables. You can actually influence these outcomes through multi-sector approaches. As I mentioned, it could be comprehensive sexual education or cash transfers. So the country is examining all these levers to try to improve sexual reproductive health rights outcomes, but also indirect ways. Because when you look at issues across reproductive, maternal, newborn, child health, and adolescent, you identify, of course, critical health systems issues across the board. So this is really, the learning we're getting from countries, this is really about strengthening health systems and primary health care. What are as I said earlier, the human resource capacity to deliver? What's the supply chain? Can it deliver across these challenges? And again, indirect, as I mentioned, through the health finance reforms, getting the domestic resource allocation in support of that. So some of these are very direct, but most are quite indirect. And as you know, that's sometimes difficult to get attention and interest into those important root causes and indirect determinants. So the ways these approaches then benefit a topic like sexual reproductive health rights is, as I said, the overall resource envelope, getting the priorities to government budgets because we are an evidence-driven approach. So based on the data that's available, how do you ensure that the priorities are reflected in budgets, improving the execution rates, getting the local CSO advocacy to ensure commitments are also translated into action and seeing this reflected, and then starting to track the resources, which is a very challenging area, as you all know. When you get into at the country public expenditure tracking, these are difficult things, but we feel that we have a commitment to try to also improve the tracking of resources, because some of us are interested in knowing, if I want to see improvement in nutrition outcomes, how can I track resources are actually going into nutrition? If you care about mothers and newborn, how do we track that? So that's an important part of something I think we need to get better at. Just to give you some sense of what's happening in countries, some examples around this issue. So, for example, in some of our front runners in Cameroon, Kenya, and Uganda, there's comprehensive sexual education is part of the high priority cash transfers for adolescent girls in Cameroon. And by the way, Cameroon is one of those countries who actually had an increase in maternal mortality in recent years. So, of course, lots of the resources in Cameroon goes to those areas of the country that's lagging behind, and to build that resilient system that can provide, quality, essential maternal and newborn health care. But also Cameroon looked at, I mentioned a social impact bond. What are some new innovative ways that one can try to influence this? We are looking at, in Liberia, as part of the adolescent effort there, at marriage registration. And I should say that there is one earmarked aspect of the global financing facility. Countries who enlist and develop this civil registration and vital statistics is part of it everywhere. So because, whatever prioritization process you use, you're not going to come up with CRVS, your highest priority. And it's one of those core functions that are so essential for all that we do. So I want you to know that that is part, and that should be credit to our Canadian partners who made sure that we had CRVS as part of all efforts in all countries. And then DRC again, quality emergency obstetric neonatal care, looking both at supply side incentives, demand side vouchers, conditional cash first, trying to get the mix of instruments that can help. That's one thing that they are trying out in Kenya. So there's a whole menu of different approaches that countries choose to take to really amplify, be catalytic with the financing that they have. I know that I'm getting close to when you're supposed to wave, so I'm not going to go in depth into Cameroon, but it's one of those first frontline countries where strong government leadership. They had 200 people when they started this process for the sake of inclusivity, good collaboration with the UN, UNFPA, UNICEF. And something I want to highlight, if you do evidence-based planning, if you really look at data, you end up in the fragile areas of countries, right? Because that's where the burden is. So Cameroon's investment is really targeting those geographical parts in the northeast where they have the biggest needs. And it's the same in all the GFF countries. Kenya is not a fragile country, but they have areas where the government hasn't been effective in reaching. So that's what they're using this facility to try to reach to. So there's a lot of, I would say, both targeting of higher impact interventions, targeting on effective instruments, but also targeting those population groups that are in the highest need. And we see that in each of these countries. So what we do, and I'm sure you want to know that, so we are in the trust fund, that small piece that tried to be the engine behind all of this. We have 3 donors, Canada, Norway, and the Bill and Melinda Gates Foundation, who have put in around $1 billion. That's what we started with. We have 6 projects that have been approved already by the World Bank out of the 16 countries. The process is underway in 16, but I think it's important for you to know that we also have approval of that link to the IDA, and that's why we can say that we are leveraging 1 to 4, because looking at the countries that are approved so far. But as I said, there are 62 countries that are eligible, interested, keen to go. So we're trying to use, countries that come say, hey, we really want to drive this. We're sharing our know-how, our instruments also with them, and we're trying to prime the pipe by supporting processes to make sure that, as we grow as a facility and can respond to more countries, we have the money available to do so. So that is a little bit in a snapshot what the Global Financing Facility is, why we're doing it. The long-term goal is to eliminate preventable deaths in mothers, newborn, and children, but also to improve, both the survival and thrival of newborn, early years, adolescents. It's to try to think very differently about financing, not vertical, but really looking more horizontally, and so creating a platform with transparency and accountability around financing. It engages many players, as you can see, but for us, it's really the important thing is that this is a government-led investment case. So thank you very much.
Thanks very much to Mariam. And now we're going to turn to Jo Borghi, who, as I introduced earlier, she has a few comments prepared to launch our discussion. Thank you.
Thanks. So thank you, Mariam, for a really interesting and informative presentation. As Jo said, I'm going to begin just by summarising some of the points that I've taken away from the presentation. And because I'm an economist, I'm going to focus particularly on the financing side of things. And then I've prepared a couple of questions, which I'll put to Mariam, but also to you, and then hand over to Jo for a wider discussion. So I think we've all seen that the GFF initiative is a really ambitious and innovative financing model. It obviously aims primarily at improving maternal, adolescent, reproductive, child and newborn health. But I think what's particularly exciting about it is, although it's an initiative that comes from development partners globally, it's primarily about increasing domestic resources to meet the financing gap, and that's really quite unique. And in addition to that, we've heard that it's also about trying to ensure that the money that is available is used as efficiently and as equitably as possible. If you remember the graph that Mariam showed us of the total amount of funding that's anticipated to be generated through to 2030, the vast majority of it was expected to come from countries. So it was only actually quite a small amount that would come from development partners. So what were the strategies for generating that domestic funding? I'm just going to go through them and then I'll go on to my questions. So the first one we heard was increasing funding, so supporting governments to generate more money. So there's just no way with current resources that they can actually meet the needs. So the first question is how to generate that money in an efficient and equitable way. The second question, once the money's there, is how to work with the ministries of finance to prioritise spending on health as compared to other sectors like education and defence. And then once the money has reached the health sector, how to ensure it sort of filters through to the priority areas of reproductive, maternal and child health. And then how do we make sure the money is actually, well, the generation of the money is done in an efficient way, but that the money is also spent in an efficient way. So I've just got a couple of questions kind of building on those strategies for resource mobilisation. So the first is generating the money, getting those additional resources, and I think it's very encouraging that the GFF initiative is actually going to work with countries to develop health financing strategies, and also guide them through the different options to find the best choice. But from the work that we've done with colleagues here and in other countries in Africa on financing, we found that there's no one fits all model. So for example, if we look at the equity of different financing sources, we found that in Ghana and South Africa, if you generate more money from VAT, so you increase the rate of value-added tax, that's actually, in Ghana and Tanzania, that's actually quite a pro-poor, equitable way of generating revenue, whereas in South Africa, it's the opposite. It's actually much more pro-rich. That's sort of an issue that we've encountered, and I was just wondering how the GFF will sort of balance out, I suppose, the competing priorities of efficiency and equity, and how they're going to be supporting countries to find that right choice. So that's my first question. And then the second question is about then how do you ensure that that additional money is prioritised for health? And from the work we've done in Tanzania, I mean, I've observed myself that the development partners for health and us as researchers in health really struggle to communicate with ministries of finance. So I think there's a sort of a barrier that we have to overcome to talk the language to make that investment case for health. And for example, in South Africa, colleagues here did a study which found that South Africa had been really successful in increasing more revenue from tax by making the collection process more efficient. But they really struggled then to invest that money in health. So most of it went to education. In fact, government spending on education increased massively over the last 10 years, whereas spending on health has really stayed very stagnant. So I think that is a challenge which needs to be reflected on. Then there's the question of prioritising investments on reproductive and maternal health, the results-based financing. That's something I'm personally very interested in, having done an evaluation of a results-based financing scheme in Tanzania. And I totally understand the appeal of this financing mechanism for donors that need to be able to show their populations the impact of their investments. But obviously the challenge with this way of funding potentially is that it prioritises attention on one area to the detriment of the areas that aren't being prioritised, the unintended consequences. So I'd be interested to hear what the thinking is on how to sort of mitigate against that. And then also, obviously, we heard about all of the sort of the financing focus of the initiative, and how I know that DFID, for example, are investing a lot in health system strengthening, and they're really struggling to actually find ways to measure the impact of those investments. So we're wanting here to encourage domestic governments to invest more in health, but then how do we first of all track those investments? Because currently data systems in countries are very, very limited. So what we can say is, okay, this much money is going to health of total government spending, but we, in a lot of countries, don't know how much of that is actually going to reproductive, maternal and child health. And we don't know how that money is being allocated across the countries. So I guess there's a question first of improving existing data sources to allow that to happen, and then identifying appropriate indicators to measure progress on the systems and financing side of things. So I think the last question, sort of stepping out of the country domestic funding context back into the aid effectiveness sort of arena, is, I mean, it was very interesting to see. Obviously the aim here is to promote aid effectiveness, to promote and encourage alignment across donors, which is really important. But I was curious to sort of get a sense, maybe from the initial country work that's happened already, how you expect, Mariam, that to affect alignment in terms of, so first of all, obviously there's the channel of how the aid money is being channeled to countries and the share that's going through government. So that's kind of one measure of alignment. And the other is then looking at how the money is being channeled to government. So is it going through general budget support, so going straight to the Ministry of Finance, which gives them a lot of autonomy in how they spend that money? Is it going through sector-wide approach or basket funding, which is sort of pooled funding, or is it going as project money, which could potentially undermine the alignment principle? So it would be great to hear more about that. So that, I think, concludes my questions, and I'll hand back to Jo and Mariam and everyone to contribute more to the debate.
Thanks very much, Jo. I'm actually going to see if we can move a couple of chairs so that Mariam, well, I don't know if you want to stand at the front, but
Yeah,
stand
we can do that. Yeah.
Jo, we might want you to stand in front too, but I don't know. You might have to defend your questions.
Yes.
But Mariam, to start with, first actually let me thank Jo. That was great, a lot of questions there. So Mariam, first of all, the ball is in your court, but then we will open it
Throw
up
it back.
to other questions.
I would quickly throw it back. You know, the interesting thing about what you said, I think the common answer to most of your questions is going back to the investment case, right? If you have a really solid investment case that looks at data, then it first of all, it steers you towards the not just the high impact areas, but the neglected areas. So if I look at all the investment cases to date, they have all steered towards family planning as a critical intervention, and nutrition. So family planning and nutrition, because it's not just where is the high impact, but where can you actually get most results from investing, and where are the big bottlenecks. The other interesting thing is that if you do analysis across reproductive, maternal and newborn child health and nutrition, then of course you identify those core bottlenecks that are common across here, right? Supplies, commodities, capacity building. So it steers you into finding those solutions in the systems. And of course, again, if you have an outcome-driven approach, you also get to some of those critical determinants. So I think that the answer to some of this is how important that investment case is, both for donor confidence, for alignment, and for accountability. The other thing I think is the question of equity. So most countries are using a tool to look at this that's called a QUIST, that actually takes into the analysis from the very beginning equity concerns. So that's why I'm not surprised. If you look at those countries that are already, has progressed the furthest, whether it is Cameroon, as I said, the countries where there is the biggest lag behind in terms of moving forward. The same with Liberia. It's the 6 counties where you have the greatest need and where they want to build a resilient system following the Ebola and other charges. So wherever, in most of these investment cases, as I said, it steers to that, but it also shows that where you don't have data, you don't end up identifying the problem. So for example, we noticed that although we know that adolescent health is a big issue, if you don't have adolescent health data that points you in that direction, right? You address what you measure. So I think we recognize that there are, data gaps that that we need to fill in order to actually fully achieve the purpose of this. But I think the other thing you said is, yes, that's why we don't have a blueprint. There isn't one approach. Tax revenues in one place is fine and not in another. It can be, so it's really is tailoring it to the individual countries, both macroeconomic context, fiscal challenges, and so on. So here is an area that clearly where we need to build capacity is around financing, financial analysis, looking at the critical factors around effective and efficient financing. What I didn't stress, but if you looked again, where are the money? They are in the private sector, right? A lot of that is there. So that's for us, how do we crowd in private sector money? So since we are linked with the World Bank, we're working with the World Bank Group's private arm called IFC, and really seeing how we can help de-risk private money to crowd that in, because I think the answer to you in terms of domestic resources, there are a lot of private sector money, and that's why last week in Davos we had the first private sector partner who came in and said we want to be part of that. That was Merck's for Mother, the MSD Merck, and they are also putting money into this trust fund because they see this potential of this to be catalytic. And also encourage small businesses, not just the Dangobis and the big investors that we are trying to collaborate with, but also small. So I think the answers in domestic is how do we get the private money, and how do we indeed make sure that we tailor it to each country's context. And that's why, again, this is why this is so important, that this truly is a country-driven process and platform.
Thank you very much. Now, we will be open for questions. We have some roving microphones. We are being recorded, so it would be great if you could use one of the microphones. I'm looking around, looking for anybody with a question. I can see one, I can see two. 1, 2. And I'm looking more in case there are others to follow.
Hi, this is Gillian Turner from DFID. Thank you, Mariam. That was really excellent overview. Really encouraging to see kind of the progress that's being made with the GFF in such a short period of time. If I'm allowed, I've kind of got two questions, or two parts to a question. One is, in the countries that have been the front runners, what challenges are you seeing around how the investment cases are prioritised, or how activities are prioritised within that? Because I think we've all seen national health plans that are, a bit of a wish list, with and the challenge really comes down to how do you match it to the budget envelope available. So interested to know how you deal with that. And then in the countries that have begun implementing their investment plans, how far or to what extent have you seen the investment plans really driving activity, or to what extent are they kind of a plan and then activity just carries on kind of regardless? And how are you kind of following that through using different types of information system? Thanks.
And we'll just take a question from Una too before.
I also have two questions. The first is, how are you addressing countries that have federal systems where, maybe you've got the federal government, but you've also got state level or provincial level? Are you doing the advocacy at that level? How are you getting to those finance people as well? And then the second was about, a lot in the press is about the global gag rule that Trump has now signed in, and to what extent is that going to influence the ability to program within the reproductive health area?
So we'll let Mariam respond to these and then see if we have
back. very great questions, and I'm glad Gillian asked the questions, because actually I didn't mention DFID in the UK. This global financing facility is actually an evolution of something that the UK was very instrumental in creating, which was a results-based finance and what we call the Health Innovation Trust Fund. And DFID in UK is still a partner in that effort. So let me also get a chance to say that, because I think that's why we could be up and running in some countries. The very first round, few countries that engaged in the GFF were countries where we didn't start from scratch with an investment case. Tanzania had its One Health plan. Ethiopia had its health transformation plan. And there is a third country, Bangladesh, that has a long history of, health swap and working very, very collaborative across many donors around results. So those are three countries which move very fast. So that's why it's easy to say that, in Tanzania, where and Tanzania was one of the first countries to also start dispersing, but they had that tradition, and it's so encouraging to see results that are being measured, not just sort of at the national aggregate level, but all the way down to community, first level facility, and at the district level, at the management level. So some countries are really at the granular, looking at changes in results at that level, while the other countries who want to be held accountable more to, population coverage. Are we getting a larger coverage of exclusive breastfeeding or kangaroo mother care or other things? So that too varies. But these are things that I want to flag, and I also want to flag that we have one or two countries who would not invest in the social sector at all with, for example, bank financing if it wasn't for the GFF. So, for example, we have countries like Guatemala and Vietnam, as you saw in this list. But what's interesting for them is to get we bring a buy down. We buy down the high interest, but then we say reinvest those interests in the social sector. So in the case of Guatemala, a nutrition project of national scale, and the down buy of the interest that we provide through the GFF is to go back and doing reproductive maternal child health in indigenous populations. So we have a whole range, as you notice here, from countries with very little domestic resources, as you said, and you have to be innovative about the private sector, to countries where we can really leverage and use these various instruments. Now, federal systems, as you mentioned, so Kenya is a good example where you have a devolution, and that's where the investment case there has taken longer time, because each decentralized unit wants to have its own investment case. So that's what they are doing there. But the interesting thing then about Kenya is that the federal government is saying, to get the resources here to do this, we would like to see what do you put in return from at the district level. So what is the commitment at the decentralized level? So in many countries where we work, as you know, there are a federal system, and where health isn't as federal entity but is local. So that's why, for example, in Nigeria, the GFF works in northeast Nigeria, clearly because there was an urgent situation, and Nigeria needed to see fast response there. But the second part of the GFF there is, again, looking at state level movement. So I think that, again, depending on the federal situation and state priorities, one have to take that into account. Around what you say, so here is the opportunity that the GFF and the World Bank offers, is that we do evidence-driven planning, right? So the evidence points towards family planning, then you do family planning. And so that's why we're working a lot also in GFF on those issues as a sort of global concern around sexual reproductive health rights, to ensure that various, individual countries' positions does not hold back that. And I see actually us stepping in even more in this area to ensure that the financing are secured for that under these circumstances. Yeah.
Okay. Oh, we have more questions. One here and one there. And that might be the very last one. So 1, 2, 3. Sorry, would you mind introducing yourself, which I forgot to ask Dana to do, because we're being recorded, so then people will know who you are.
Yeah, so Tanya Marchant,
Comments to now.
Department of Disease Control at the London School. Mariam, you've just done a fabulous job for me of bringing to life what is happening at the country level. To dig a little bit deeper into that, how is it actually operationalised? Who would one speak to in Kenya or in Nigeria? Or do you have a whole cadre of people working for GFF on the ground in the countries, or is it entirely embedded through the ministries?
You were two, and you were two.
Hello, I'm Turjana Raza. I work for Save the Children. Thank you very much for a very interesting and useful presentation. I have a question about civil society participation, and I wondered if you could tell us a little bit more about civil society engagement at the country level, because I think it has worked better in some contexts than others, and there has some challenges around the opportunities for civil society organizations to really participate and engage in the process. And if you could tell us a little bit about where that has worked and where organizations have managed to really engage in the investment cases in particular. Thanks.
Thank you. Fiona Campbell, a student at the London School of Hygiene. I'm interested. Thank you very much for a really interesting presentation. Assuming that countries do manage to raise more financing, and assuming that goes to health, what happens in countries where they may be trying to raise additional funding for other health issues, such as non-communicable diseases, for instance? How is the GEFF working with countries to sort of prioritise other priority health interventions?
Great and tough questions. Interestingly enough, your question is, who do I contact, is very much related to your question from SAVE, how do I engage? Because there is a lot of expectations around this, especially in civil society, and the question is, who do I contact? So that is something I think we learned from the first 16 countries, especially the first front runners, that when you have a country-driven process, even we, maybe in the GFF Secretariat, would ask that same question. So how do we improve of that? That's, someone asked what are some of the learning from the first period that's been challenging. This, I think, is a very important lesson. How do we get better and identify who in the GFF Secretariat work on a certain country, who in the country is my go-to person, and where is the country in the process in terms of milestones. So I think you highlight an area where I think there is a lot of things we can do better, and that's why I mentioned that the civil society has been working together, representatives, on a strategy for the GFF. As you know, we are very young, 18 months, to present in April, which we will take very seriously, is how do we learn that? Because the whole idea here, as I said, is not a government-led financing facility. We're talking about a country-led. And because civil society has so much to contribute, especially I mentioned the case of Tanzania, where we have local results. So for me, it's not just being part of the process from the beginning to the end, but who sits at the table, but also how can we actually use civil society more powerful by actually looking at accountability on the ground. So there are many functions, and then so this is work in progress. Some countries, as I said, have done a better job than others, but it also depends a little bit about, again, internal dynamics. And so, Cameroon, a very inclusive process. Right now, Sierra Leone is engaged with a very broad and inclusive process. And I also think that after the first 5 countries, the first front runners, we have also got better. I also think that now, where countries where we start from the beginning with an investment case and not just jump on an existing plan, we can also do much better with this. So this is an area where I think is growth and learning, and especially from those who have succeeded. And the lesson learned, I think, is where you start really from the beginning, you're more likely to draw in those voices and that representation. But since you raised this question, I also think it is more of a challenge is really how do you get the right civil society organizations in countries engaged. It's very easy to identify the champions in international NGOs who care about these issues, but how do we build capacity of CSOs in countries. So since I mentioned that this is a partnership, we also work with other partners like Partnership for Maternal Child Health to see, can we use them to help, or others to help build that capacity? Can we use international NGOs to play that role? So we have done 16 countries, but we have 62 countries. So I think there's a lot of potential for us to get back better at what you just raised. And the go-to, so we were trying to also do much better job at the go-to person and the process and documenting that as well as we can to help also bilaterals who want to know, what can I contribute? Yeah.
And the question of a different priority?
Yeah, that's of course an excellent question. So what we're trying to do is, of course, provide governments with the data to make a case for where is the biggest bets in terms of investments. How can countries, especially when we talk about domestic resources, how can we ensure that they actually go into those things that make the greatest difference? And if you do that analysis well, then of course you end up also identifying not just health, but the role of education. So some of our GFF trust fund money and then the money that comes both through bilaterals and through the whole pot of money goes also into education, keeping girls in school. And for us, it's very important to emphasize that this is about mothers, newborn, early children in the early phase of life, and adolescents. And if you look at people and their needs, that again opens up for contributions from other sectors. So we are not out there to try to shift allocations unless it's on the basis of allocative efficiency, as economists would say. Really looking at where are the biggest, highest impact in investments across sectors. So very important, and that's why I think you end up steering, talking about NCDs. If you're strengthening primary healthcare services, then you also create platform for NCDs. If you look at the cause of maternal mortality and you see the shifts in that, and when you start to pick up that obesity and diabetes is the driver, then you invest in that. Right? So I think, again, really getting good about the data and the data that generates that. An area where we have much more to do is really not looking at the poverty income equity lens, but also at the gender lens at this. So, as we move forward, I think we can get, better and better at how we guide countries to do this in a way that they get the highest impact for their money, that it's not a competition between sectors, but how do you get, especially in the SDG environment, how do you get all sectors to contribute? How do you harness all sectors for your outcomes that's in the national plan?
So, it's now 6:30, just after. I would like you to join me in thanking Mariam very much for coming to speak to us. And outside it's a really nasty, cold Thursday evening and there was a tube strike. So please, don't think about going home. Come and join us for a drink and some nibbles, hopefully downstairs. Thank you.
Take the tough questions.
Yeah, and she'll take the tough questions then.